Look how tiny they are. They're so small. That's a quarter in there in the middle. Look how tiny they are compared to it. Hi, I'm Dr. Rich. Welcome to my YouTube channel. I'd really appreciate it if you'd hit subscribe and also click that like button. That really helps me out. Thanks so much for watching. So today I'm going to talk about the tiny torque wrenches and other tools that dentists use when they work on dental implants. If you want to learn more about dental implants, I made a separate video talking about dental implants. I'll leave a link to it in the description below so you can check it out. So in that implant video, I talked about the two different brands of implants that I use and the different ways that teeth attach to those implants. One's a press fit. The other one uses a small screw. So in today's video, I'm going to show you the tools I use when I'm dealing with those small screws in the dental implants. The tools come in two parts. There's the wrench, usually a ratcheting wrench part, and then the driver bit, which is the part that actually fits into the screw. And just like on a car, the screws come in all different shapes and sizes and different patterns. So in a car, nowadays you'll see Phillips head screws, you'll see Torx head screws, and then in some brands they have their own little proprietary shapes, as well as standard Allen head screws. The screws for dental implants are very similar. Majority nowadays are hex head, but there's been some slotted ones, there's been some Torx style drivers. It seems like each implant company has its own specific size driver or style and shape of driver. It gets a little frustrating because the screws are so small, it's difficult to tell sometimes which is which, even by using magnification to see it close up. These are the various drivers I have in my collection. Quite a vast array. The top ones here are basically all hex drivers, kind of like a standard Allen head key, but they come in all different sizes. Some are small, some are kind of large, like this one for instance, and then some are so close to one another that it gets frustrating to, especially if I have a patient that comes in with an implant brand I'm not familiar with. And you gotta look at, thanks to Google though nowadays, we can Google it and find out what size they use. On the bottom, I have some socket style drivers. These aren't used as much anymore. We still use them though for overdenture attachments. Actually, that's what this triangular shaped one is. That works pretty well for one brand of attachments. There's other brands too that come in different shapes. And then this one is a proprietary driver that I just got for a brand of implants. It's kind of like it's almost like a Torx head, but a little bit more rounded. So this is my collection of torque wrenches that I use. They come in two different styles. So this is the beam style of torque wrench. As you twist it, this lever gets deflected and you can see how much torque you're putting on the screw as you're tightening it. The other style are a click type. As you're tightening this one, it'll make a click, and in this the handle will kind of give a little bit, and that tells you that you're at the proper torque value. This style comes calibrated for a specific torque value. So this one is 30 Newton centimeters. The beam style, because you have a direct readout, you can change how much torque you're putting on it. So this one you can torque something to 10 Newton centimeters all the way up to 70 Newton centimeters. This model down here helps you access back teeth. Put the bit in here, the driver, and then you place it on the screw in the implant, and then you just twist this. This is set for 20 Newton centimeters. This one's pretty old. I think this one dates from the maybe the late 80s. I don't use this one very often at all. But every now and then, if it's a hard to reach implant, it comes in handy. So this is my newest torque wrench, ratchet, and driver assembly for a brand of implants that I haven't worked on before. So it's kind of interesting. It consists of the driver and the ratchet handle, and so the ratchet just slides in, you pull this out, fits on the head, and now you can ratchet to tighten a screw up. And once you have it down all the way, the torque wrench part of it just slips on the end. You have the driver in the screw, and you just press down on the beam and you can apply torque. And it goes from 0 to 35 Newton centimeters. These are some of the screws that we use the drivers on. As you can see, they're very small. That's why the drivers are so small. In addition, because the screws are so small, that's why we only use pretty low torque values. So generally in implant dentistry, most of the time we use anywhere between 20 and 35 Newton centimeters of torque. To convert that to English units, 35 Newton centimeters converts to about 3.1 pound-inches of torque. To convert that into pound-feet of torque, which you will probably be more familiar with having worked on cars and whatnot, or even just tighten the lug nuts on your car, 35 Newton centimeters of torque is equivalent to 0.26 pound-feet of torque, so not very much. To give you a difference in sizes between my dental torque wrench, right behind it I have my inch-pounds torque wrench. That's the one with the black handle, and then behind that is my foot-pounds torque wrench. Quite a size disparity. Then again, the screws that we use on dental implants are much smaller compared to a typical nut or bolt you'll see on a car. So that's the end of the video. If there's any other dental topics you'd like me to talk about, please leave a comment below. Thank you so much for watching, and please be sure to subscribe and hit that like button. Thanks so much. And remember, only you can prevent cavities.